Yeah, well, hello everyone. So we have talked in the previous roundtable about quality. So of course we have already tackled the questions related to the organization. So we will probably not really going back to the description of the situation and all the current situation as we already see it, with all the difficulties that we are facing in making this journey very smooth. But I would like to, for this roundtable, to go further and faster. So we will be talking about this organization. So, Emmanuelle BARLERIN, you are a nurse and you are a defender of the coordinated exercise of healthcare in the domain that you are working in, and probably to go a little bit more into the tangible parts of it. So, what did this coordinated exercise change for you in your practice, and how does it happen in your everyday life? Why do you believe that this is something that actually brings forward something positive at the level of the healthcare system? So, hello everyone. Yes, I am a nurse, and I have started the school in 2010 in an isolated practice in a cabinet of a group, and in 2013 with the elected representatives of my territory, and together with all the different organizations, we actually found out that the coordinated exercise probably would be very interesting and positive in our territory in terms of coordination. So we have started this project altogether, and this was the project for the healthcare establishment. So what did I find in this exercise and in this project that was very pluridisciplinary? Well, first of all, I was able to find a lot of activities, like a center of activities, because we were able to broaden the scope of professionals in the healthcare that were present in there. So we actually were able to implement it with the elected representatives, but also with the inhabitants, and we were able to get everything that we wanted, meaning the offer of the healthcare that was much broadened. And in the practice, I also was able to find and meet colleagues that were very trustworthy, that could provide me with new information and broaden my scope of views and skills and knowledge. And I also understood many additional things that I was able to find there. And before becoming the nurse going to the patients, I was working in a hospital. And it actually was very important for me to understand the interests of the patients, of the treatments, but also all of these additional meetings that we have, the follow-up meetings, and what was the interest of all of this. So I was able to share this experience with my teams, and I was able to share it with my colleagues nurses, but also general practitioners. And we were able to develop this very important support at home for the patients, especially for the patients who had problems at the mental level with mental health. So it actually broadened the scope of our interventions in a very important way, and it added some elements that did not exist before. So we had, for example, some doctors who would prescribe things that were not always very much adopted because, well, the follow-up was not the same. It was not the daily follow-up for the patients in consultations. We also had the oncologue who came and who was able to train us all together. So we were able to share the knowledge, we were able to share the information, and it was a win-win situation for all of us because finally we were able to learn something all together. So it was a brand new experience for us because everyone was sharing their knowledge. So we were just putting it all together. And right now I think that it was a very positive experience. So positive for everyone, but also positive for the collective, at the collective level, and for the patients as well. So it was a coordinated exercise, right? Yes, and the conclusion here is that we have to go more toward teams and toward teamwork because, yes, well, we have this healthcare institutions. Well, I actually represent this healthcare institution federation at the national territory, and especially in the rural area next to Loire. So I believe that we have to move forward toward this model because right now we have 45 professional institutions like that, and we are 880 social institutions like that at the national level in total, I would say, and 45 in our territory. So I would say that we need to have additional entities like that opened, but also we have to work all together as a team a little bit more. So probably to look at the means that we have here to explore it and to move even further forward with all of this, because for this healthcare organizations, healthcare houses, as we call them, it's actually possible to support the coordination of the teams and to improve our results here. But right now, when we have such institutions for 15 to 20 professionals in average, I would like to tell you that we are still far from what is really necessary to be able to go to move into the teamwork a little bit more. Well, I understand that this has an economical component in here, but also when we're talking about this pathway, this journey, we have to work in teams, but also given this trust, a certain degree of trust to the professionals that are part of the team. And, well, it actually has to come from the team so that the team would be, let's say, offering something, not just the skills, but also the ideas about the functioning of the organizations and the institutions, and to allow us to probably reorganize a little bit our approach. So it's actually, well, for this healthcare facilities is the delegation of the competencies as well. Yes, well, in this healthcare facilities, we actually have this coordination, and this coordination is here so that to create a link between all of the professionals. So it's something that aims at the increase of the quality, and we were able to talk about it in the previous debate. So we want to increase the quality, and if we don't want to change the healthcare professionals and administrative tasks, we actually have to find another function, another position that will be in charge of all this, so that to organize, so that to make it easier for the healthcare professionals. Well, it can also exist as a protocol, for example, and this is not a very big term, but it's just an agreement on how we are going to proceed, and this is what we're doing more and more. At the same time, we were able to find some difficulties at the very beginning in this process, in moving toward this vocabulary, even, I would say. Yeah, I totally understand. Yes, it's quite practical, and it's basically how can we offer also the possibility to go toward additional quality. Additional quality also means additional research in primary care, but it also is the possibility to probably stop and think about what can be improved even more. And here we actually are aiming at this specific areas of research, of understanding, but also of delegating skills, competences in organization as well. Thank you very much. And now I would like to give the floor to Didier JAFFRE, because you were talking about the IRS at the very beginning of this coordinated exercise. So we actually have to develop this healthcare facilities, but also work on the financement of this healthcare facilities and the practices. So right now we are in 2025, and we have actually found this region where there will be the very first French healthcare facility like that. This will be Occitanie. And will this allow us to implement the coordinated exercise, Didier? Thank you, Guillaume. Well, no, I actually think that it has already been said. Well, first of all, I think that we have the offers of care, the offers of treatments, but I would like to represent here the inhabitants, because first of all, if we are all here today in this room, I would like to say that if we are even paid, this is because and thanks to the inhabitants, meaning that the French don't have the similar access to the health care depending on their situation and on where they live. And this idea of the French healthcare facility is the idea of offering the service by satisfying this increasing demand of people, and not just in the rural areas, because of course the rural areas are in first line here, but we don't have to oppose the rural areas and the cities. We actually have to make sure that this health care will be present absolutely everywhere. But it actually includes many different points. Well, right now I'm in this region where we have approximately 40 different small facilities, but we also have some spaces and places, regional places, where there is absolutely nothing. So the French healthcare facility will be here, and this French healthcare facility will actually be present in different ways on different territories. First of all, there will be territories where there is absolutely no offer, because, well, the question is whether these people who live in there have to move somewhere else to have their healthcare. Well, no, actually the healthcare must be provided where they live, because I believe that this is probably the very best place to do the prevention, because the regional and the professional fight is incredibly useful, but it has to be there in place for people when they leave, because if you would like to probably target the elderly people and sick people or whatever, it has to happen where they leave. So I think that this is one of the biggest missions of this healthcare facility in France. And I think that in these specific places that are quite far from the healthcare facilities right now, must be served. And we have created this medical bus and things like that. So there are different initiatives moving toward it. We also have some other places, other territories where we already have an offer. So we will have some healthcare facilities or things like that. And it actually has been labelized. And well, you said that the first French healthcare facility will be in Occitanie, but well, I would like to say that several months ago, I had this idea to think about the possible experiments, because, well, we understand that for these healthcare facilities, we will have different ones. They will not be similar to one another. So why not make experiments with this? Because right now, well, we have this difficulty for organizing. So why don't we create one of these healthcare facilities now next to the service facility? And I actually wanted to go even farther with that and provide additional services and consultations, orientations, guidance to the population. So I was thinking about the necessity of doing it, because we understand that many services or many treatments are impossible to manage for the inhabitants, and probably people will be like, well, I have this pathology, but where should I go? So they need this guidance. Or probably people will be like, yes, I have this elderly person at home, so how should I deal with this? So I was thinking about experimenting with all of this, and the Prime Minister has already mentioned it. And then also we have the cities, the urban area. We have some sensitive parts of each city as well, where we have this desertification of healthcare as well. And healthcare is prevention, and it's also a social connection. So this is part of the pillars of the Republic. It's like education. So if we no longer have healthcare on the territory, well, this will be the end of the Republic, which is why we have to do our best to make sure that this is available. But we don't have to forget that first and foremost, the inhabitants are here, and this is for them. So for the healthcare facilities, the goal is exactly the same. We have to coordinate everything. We have to make sure that the professionals will be happy, but we also have to include the inhabitants. And well, this is something that I am highlighting all the time, and not everyone is happy about this. Well, I would like to say that right now, approximately 20% of the population are pretty much covered by these coordinated efforts of the healthcare professionals. And 20% is already good, because this is a progress for this last couple of years. But if we're looking at this model, we would like to have actually 80% and not 20. How should we do it? Well, this is actually something we're used to. We always want for everything to work and right now, but we have many professionals that are in their specific rooms, in their specific institutions for years and years, so we will not just let them die, because they need to continue working and continue living. Well, we have to evolve, and I think I do not believe in models, because I believe that the models do not exist in each and every territory. The professionals, together with the elected representatives and with the users, will be deciding something. So I believe in the contract, local contract for the healthcare, because this is the level where the decisions are made, and they will create the best solution. So probably this will be something mobile, something that will not be fixed within a fixed building or something. So probably the elected representatives will be creating some rooms that will be hosting or housing for a small period of time this healthcare facilities and this healthcare professionals that will be moving later on to a later place, whatever. But actually all of the tools that will be there will be very useful, but we do not have to oppose the liberal exercise of the healthcare professions to the coordinated one. I think that we have to all work together and find the best way of satisfying the needs, but also the needs of the interns, of the new doctors, of the young generation that is coming here. So everyone who is coming to a certain territory must have the possibility to discover this territory, to discover the profession. And generally, if we do this, if we adopt this approach, the results will be positive. Well, thank you very much. I'm going back to the beginning of your intervention. You have talked about the patients. Well, the patients that will probably need to go to hospital, to a hospital, and then to have certain assessments done, certain examinations done, and sometimes it will not be available. So I would like to address now Sophie BEAUPÈRE, who is working working with cancerology. So this is basically very much practiced, very organized patient journey with a lot of different interventions. So how does it happen between the center of the cancer that you're working in and the general medical landscape, I would say, with all the other stakeholders that are there? Well, first of all, there is an organized journey, and there are meetings that allow us to coordinate the treatment of the patient, but it has already been highlighted during the previous roundtable. Today, the financement system and the working silos of the financement system between the healthcare establishments and the professionals in the city does not favor naturally the coordination of all the different stakeholders. So, of course, we have the article number 51 that we have already mentioned by Agnès Buzyn, and we also have this difficulty to generalize it, but I believe that this is fundamental, the article 51. It allows us finally to go closer to the scientific and technical evolution, and I'm taking here the example of the oral chemotherapy, because I believe that everyone understands that whenever we have it at home, we actually need to have a coordination of this journey, of this pathway between the liberal nurse, but also the expert establishment and all the other stakeholders. Well, of course, we have this Article 51, but the evolution takes a lot of time, the evaluations as well. So I would like for us to move even faster, and this is clearly seen. So the system of the financement, such as it is right now, does not really allow that. Well, but I believe that this is not something that will cost much more to the insurance. So we have to actually remind them that all the projects for the Article 51 are already validated, with the only condition is that they will be generating savings. And this savings basically will be generated by the compensation of the actions of each and every stakeholder. This is the first point. And the second point that has also been mentioned is that obviously, well, something that will be very much an incitative and improve the coordination is to develop the quality that will be evaluated by the patients. The associations of the patients are very supportive, and they are communicating a lot among them. So I believe that this is very important to make things move forward. So we have the financement TIDOSA, we have this financement for the quality that actually exists, but this is 0.4% or something like that. So this is very small, and this is not a very good motivation for the stakeholders, and that's fundamental. And the third element here, well, I believe that this is the gradation of the different treatments. Well, who is talking about these grades in treatments is talking about the close work between all the different stakeholders, but here we are also talking about the expert establishment that will be helping all the existing structures that are facing a lot of different challenges today in terms of having, let's say, the opinion of a specialist, because I was working in Auvergne-Rhône-Alpes region and in the expert center de BEAUPÈRE that is helping the general establishments and organizations in Ardèche, in Drône, because over there is a huge difficulty in finding the staff. There is an important difficulty in terms of the labelization of the quick chemical services, but also organization. So all of this work is very important, and we have to make sure that the services, the treatments are provided and the needs of the patients are met. So in order to be compliant with all the standards and to take care of the patients in the right place and at the right times, everything must be working in a coordinated way. Well, of course, the evolution is very positive. So we can see that in they are very paying a lot of attention to all the patients, but I understand that this is something that must be implemented in a general way all over the French territory. Thank you very much. So we have been talking about these grades of treatments, this grading system. We have also talked about the evolution of the healthcare system in the cities. So now I would like to know how the hospitals are fitting into it. Thierry GODEAU, can you please give us the point of view of the hospitals? Well, of course, we have actually many different topics here. First of all, we have the evolution of the hospitals per se, but also within their environment with all the stakeholders around. So the evolution of the hospitals per se has a major challenge here, and I believe that this is basically also very much related to the hospital groups that are struggling today. I think that this is also a major challenge, but here we actually must understand that we cannot do everything everywhere, but we can organize the specialized healthcare by what we are calling the teams per territory. And this will not be like really specialized care for every single hospital, but this will be teams that will be working on each and every territory, turning around background and making sure that there will be all the consultations provided at home and everyone will be followed up. So it does not mean that we will have to close all the different establishments and remove the beds. No, it means that we have to be more flexible. Well, of course, we have the resistance that we're facing with this approach. Well, there is, of course, the resistance on behalf of all of the stakeholders for this reason or that, but I think that this challenge must be tackled. And we have this limitation, which is pretty much related to the medical training, which is too specialized. And this is kind of difficult when we're talking about different pathologies in the patient. So we understand that we have to reorganize the service and make it much more multidisciplinary. So this multidisciplinary doctors and so on, this is not the training that is very much developed here. And it is still insufficient, despite the fact that a lot of doctors, a lot of practitioners are very much interested by that. Well, you are talking about the multidisciplinary, in which sense of this term? It means starting from the training? Yes, indeed. I'm talking about the medical field of application. So what is called actually the medicine, multidisciplinary medicine. And I think that this is pretty much a gap right now, a gap in terms of training. And we have to be worried about all of this because, well, we are recruiting general practitioners, but we also need general practitioners in the cities. And I believe that we have to integrate this point into the training, the medical training, so that to make sure that there will be this multidisciplinary approach. And I believe that if we have this multidisciplinary approach, well, it will be reorganized at the level of the territories, and we will have probably exercises that will be mixed or probably just for the city or for the rural area or together, and we will be able to pretty much be more flexible and cover better the population. So I think that that's an important challenge. And when we're talking about the coordinated exercises, I believe that the doctors are still not very clear on what exactly is the added value of a doctor. And for the hospitals, this is the question of what exactly is the added value of the hospital. So we are not really we didn't really make a lot of progress in terms of all of these questions, but I think, and this is actually very relevant for the service I'm working for, we have some disciplines already. We already had some multidisciplinary approach, but we are very shy with moving forward on it. But I think that that's an important point to take into consideration. And in terms of different territories, we will have the positions of jobs, medical territorial jobs, but I think that we have to create some additional jobs in there in terms of the organization. Well, in terms of the advanced practice nurse, we have talked about the Article 51, but I don't really think that there is a specific point related to the advanced practice nurses here. But it actually proves that we can do a lot of things here and probably also improve the quality of the treatments and of the journey for the patient by tackling it through teams that will have some doctors as well as nurses. Well, of course, here we're talking also about the general training, so that to have a necessary number of advanced practice nurses. Well, yes, of course, and this is part of the exercises that will contribute to this valuing of the hospitals. And I think that this is also valuing in financial terms. So that's an important topic. But I also think that we have to look at the territorial level, so that to have this specific exercise on the territorial hospital groups. And, well, that's an important point here, an important aspect, I would say. And for the interns, I think that they also have to have the possibility to exercise in teams at the territorial level because, well, the doctors very often would have some exercises that will be for many different, will be exercised in their profession in many different hospitals at the same time. But I believe that this is a great opportunity for the interns as well. And we also have talked about this important pillar, which is cities, hospitals. Yes, of course. And we were saying that it's very difficult to organize all the patient journey and the treatments here. And we were talking about it a couple of days ago already with all the articles, because the goal for us was to actually talk about this graduation of treatments. And, well, from your point of view, this is very often the problem related to the nurses and to the other hospital centers. Well, no, I'm not saying that this is their fault, because I believe that everyone is facing a lot of pressure. And I would like to go back to what Thierry has just said. I think that this boils down to the willingness of men and women. And with all of the establishments in the West, the regions, West regions, we have been able to see that everyone is going to the peripheral areas. And it actually works very well. So the chief of a service, let's say, of cardio service, will be working on his or her service, and the same for neurology, and the same for every single service. So I think that, well, it's important to do it between all the different establishments, so that to have this deployment at the territorial level. So you see what I mean here is it's important here to make sure that people will not have to go to the university hospitals, to the university hospital center, but the university hospital center will come and meet the patients. So it will be done at the peripheral level and so on. And we actually have evaluated it by organizing the survey for the young people. And they actually said that it was the best, because when they were doing this training, moving from one establishment to another and working in the peripheral areas as well, they were super happy, because they said that they were learning this multidisciplinary approach, and their skills were increasing. Well, of course, we understand that probably the surgery will not be done in one place. Nonetheless, the specialist will be coming as close to the patient as possible. So I think that, of course, this is an exercise that requires a lot of energy, and of course, we need the financement, we need additional support at the regional level and so on. But we have seen that the results are here, that this works quite well. And we, of course, have to monitor the situation. And Sophie has already talked about it. Well, quality and safety are important aspects here. But we have to really monitor the situation, because we are just humans. And I have always said it. I had once been a president of the Transborder Hospital in Europe, and it was the smallest maternity that existed. But the quality related aspects were very much in compliance with all the standards. Why? Because the whole hospital was behind it. Everyone was really paying attention to all of this. And my colleague from Poland said, well, all of this will be very expensive. I said, well, if we look at Catalonia right now, well, we will have probably quite 8 million people that are living there. If we're looking at Occitanie, we will have 2 million people here. But I don't think that the situation in terms of health is very different there. So these are choices. What are we financing? And in terms of this grading, we, all the actors, have to really pay attention here, because this is not just the story of the national territorial hospitals. It's not the story of what is public and what is private. I still understand that the weight at the private sector is so important that we cannot really believe that the territorial hospital groups will be working separately and be much better than the private sector. But I have always said we have to unite our efforts, because those who will be staying alone in silos will not be able to survive. Whereas if you will be able to survive in terms of quality, in terms of research and so on. And here it's important to unite, because otherwise the inhabitants of this territory will no longer have any offers, let's say, for cancerology or something like that. So I think that that's what we have to call all the professionals to organize themselves, to work together. And then at the end, or from time to time, we will be able to evaluate this collaboration and then compare it to the satisfaction of the inhabitants. Well, we are talking about the hospital in the city. So I would like probably to go back to your experience. So what are your relationships with the hospitals? Absolutely excellent. Excellent, because we also practice this approach to going forward and talking to the hospitals, because we have understood that there is a limitation of the city, but there is not just the city, because just as within our team, we have this journey for the patient that we have to make sure is organized. So we actually worked with hospitals, and we also invited them to our healthcare facilities, and we had the consultations organized by the hospital professionals. So, of course, cardiologists and some other important professional specialists. But we also had a different healthcare facility, because we are at this crossroads of many different healthcare facilities. And we decided that it was crucial for us to go and look for all the different expertise and to bring this expertise to our territory, so that to really provide a service to the population. So all of this happens very well. Well, it's of course course, a lot of time because we have to come, we have to explain what we have to do together. We also have to bring the elected representatives with us because, well, the elected representatives at the territorial level have this very important presence because they are also supporting the investments. Well, it's not always the case, but very often for the healthcare facilities, the territorial collectivities have an important role to play. So we basically fix an appointment with a doctor from the services that we're interested in, if I can say so. And then we have a discussion. We are meeting together and we think about what we can do together. All of this works very well. We also have some adjustments and probably a little bit of delegation, specifically for the cardiology, that allows us to do some treatments through the digital technologies as well, and also have this analysis done through the digital technologies to see whether there is a necessity of adaptation of the treatment. And this is very practical because instead of traveling for 40 kilometers to go to a consultation that probably is not necessary for the patient, the work of the nurse or of the doctor is very well organized, and it's actually the possibility to provide the service to the population by the cardiologist, which is very important. And well, this link that we have with the hospitals is very easy with our interlocutors. Well, it actually is something that is making us happy, as you have said it, because, well, it actually increases the level of our skills and the facility of our work. And of course, the inhabitants are very happy about this. So a lot of positive energy here. Yes, I understand. Well, yes. So it was a little bit difficult at the very beginning, but now this collaboration is quite close with the healthcare facilities. Thierry, do you think that this model is interesting? Yes, indeed. This model is very, very interesting for me, but, well, the problem is that I also have some very interesting results from my experience, and I would say that the environment of the hospitals still can be improved a lot because we have stayed in silos for a lot of time, for a long time. We have been calling each other and probably discussing some things, but still staying in silos. And it actually depended on the different issues that we were meeting, but this was problematic. And, well, we were talking about this 20% of improvement, but, well, we have to be very realistic because all of this depends a lot on the good willingness of the stakeholders. And unfortunately, this might create problems as well. So, well, I actually have several proposals, several suggestions. Well, first of all, I believe that the relationship with the hospitals, first of all, it depends on the digital aspect. Well, the digital aspect is not very developed. We have already talked about it. But when we're talking about the journey, the coordination, well, the digital aspect is not there yet. Well, it actually moves forward very slowly. We don't have everything in there. In the hospitals, sometimes we don't have the access to the space related to the health of each patient, to this profile, health profile of the patient. Some patients are like, well, why would I, some doctors are like, why would I put it all online if I already have it? So it actually creates a lot of problems in terms of the coordination because, well, this is a tool. Well, I'm not really a specialist of all of it because I understand that there is a problem also of the data sharing, but this is something that really impacts the quality, but also the relevance. Well, now, there is another model that exists already, and this is the CPTS, as we call it. Well, we actually have to create meetings between professionals. So not to make it just at the institutional, very formal level, but among professionals. And I think that the very first thing that we can do is like the entry and the exit from the hospital when the person comes to the hospital and leaves the hospital. And we have to, well, basically understand each other in terms of this journey that happens in the hospital. We all understand that everyone has difficulties in terms of coordination, but we have to move forward all together. And, well, we have created, thanks to the CPTS, the shared transport for the daily care in the hospital, for the psychiatric services, but also for some other services. So I think that's an important topic. This is coordination, and CPTS has different budgets here. And I think that this budget have to be allocated to specifically this coordination between the hospitals, because that's an important challenge. Something also that has been created and is already being created, these are the specialized teams. I think that coordination around these teams can also be very important, and we have to give them the goals that will be shared as well. So I think that the chief of the service should definitely work here in terms of the territorial development, because, well, these are their services and it has to be part of their technical specifications. They have to work at the territorial level, and this specific territorial teams, hospital-related territorial teams, have to be in charge of this mission, shared mission for all the population of the territory. I think that the programmed treatments, the programmed care is something that cannot be avoided, because even though we are talking about the fact that 97% of the territory are completely covered, we still have a lot of people who are coming to the emergency care for different reasons, probably for scanning. Well, this is probably the problem in terms of scanning or in terms of some other aspects, but also there is a problem related to the financement that is linked to this. So I think that we still have to look at it very carefully. So there are many different elements, and actually sometimes it's a little bit also difficult to move the patients from one place to another because the organization is a little bit complex. So there are still points that we can work on here between the public sector and the private sector as well. So we have to work together once again. And we have been talking about this local health contract. I think that that's an important topic, because for us, this local contract, healthcare contract, we have to work among hospitals and all the different professionals in the healthcare sector. And I believe that at a certain point, the need is to formalize things. And I think that the territorial projects for health must also have some measurable goals in terms of quality of care, probably. Well, we can actually also imagine the common accreditation, the common licensing of the specialized teams at the territorial level with some goals related to quality. But I think that we are actually talking a lot about these hospital territorial groups with the elected representatives, but also all the other stakeholders. So how all of them together provide an answer to all the issues that exist in this territory, that's what we have to look at and supervise. Well, you have talked about many different tools. I think, well, we have the CPTS, we have the local health contracts and so on. So what you from the Anti-Cancer Center are thinking about this? Well, of course, we have talked about the digital elements while we were preparing this roundtable. We said that the tools were progressing quite well, but they were not really used 100% yet. So, Sophie, what do you think? Well, of course, this is something that allows us to improve the coordination. All the tools that have been covered right now are in terms of the territorial coverage, but of course, the digital tools allow us to improve the coordination if those tools have been assessed in terms of their use. And here also comes the responsibility of each and every one of the stakeholders is the strategy of the digital, because the problem for each institution is the mixture of tools that exist for each journey and what is the added value for each solution. So there must be a certain global strategy that will allow us to assess all these tools and to figure out what is the added value for them. Well, I think that, well, it's important to have the strategy for all the tools, but also for the training of the professionals that will be talking about these tools, because, well, we understand that there will be new jobs created, like with the use of the artificial intelligence and so on, and this will be the jobs that will evolve a lot. It will not be just a medical assistant, but the new version of this medical assistant, and it will be evolving more and more toward the coordination of these journeys. And I think that we have to anticipate all of this. The artificial intelligence is already here in our establishments, and the example is the radiotherapy, because, well, in France, no matter what the status of these institutions or organizations is, everyone is using the artificial intelligence in terms of evaluating the organs of the patients. And that's a big progress. It helps a lot. But at the same time, we have this responsibility because, well, we have to show through all the studies, robust studies, the added value of these tools, and also how to evaluate the framework for the financement of the different establishments. Because, well, I'm looking at the CCTV, for example, for the surveillance through the cameras. That can be very important for cancerology and some other fields as well. But it's important to understand that the fixed fee that is given to the operator for the financement of a certain time of use of this technology will be characterized by a simplicity simplicity of it for some patients, for the evaluation, for example, and will be a little bit more complex for the patients that might have comorbidities. So we actually have to make sure that all of this corresponds, and for this fixed fee, the problem is that right now it's the same for simple patients and complex patients, if I may call them so. So this is a major tool, and right here already we see this issue, whereas this is a major tool that we're using. Well, yes, I understand. So basically each and every stakeholder has to be vigilant in choosing their tools so that to make sure that the tools are assessed and also very relevant. But in terms of the coordination and connection between different stakeholders, there is also this very autonomous character of each and every organization and establishment. They're using their own tools, the tools that they choose, and this actually does not contribute to the good coordination, just as when we move the patient from one place to another, it actually can create problems. Well, I understand that we have this heterogeneity in France from this point of view. That's different in other countries, and we already know it. Nonetheless, the interoperability of the digital solutions allow us to still speak the same language and be on the same page. And there are all of these different softwares that we are working with that allow us, for example, to create a data storage, to centralize the data storage. And this helps us moving towards this coordination and also have an answer to some scientific issues. But today, well, I think that in terms of the digital solutions, we have the solutions that allow us to aggregate the data that is coming from different solutions so that to evaluate the journey of the patient from the medical and economical point of view. For example, if we have the storage of healthcare data that allows us to use it together with the SNDS and to be able to provide the answers to the medical questions and to do all the very important solid and robust analysis. Well, we have all talked about the digital aspects, but we have also talked about the prevention. So I would like to go back to it, probably going back to the local health contracts. Didier, that's an interesting thing here. Right, I would like to go back to what Thierry has said, because I believe that through this local health contract, we will be able to do the real prevention. It also includes for the IRS, it actually has to change our way of apprehending this work, of seeing this work. Well, with this local health contract, well, this is pretty much a paper, but then it has responsibilities that must be entrusted on the stakeholders that will be implementing all of this. So for us, it's important to define the goals, but also to provide the means to implement all of this in practice. Well, of course, the finance, the coordination jobs, and so on, but the financements are not really there. So this local health contracts, we are talking about this local health contracts together with the financement. Yes. Well, I'm trying to change this situation by saying that now everything will be happening through this local health contract. Well, right now I have more than 60% of the population that are covered by that. And the teams are always asking, so what do we do with the rest, the 40% remaining? Well, they will have additional contracts, the contracts for the health centers. Because, well, if all the time we're looking at what does not work, we will not be able to achieve our goals. So we have to pretty much consider what is already working. So if we have some healthcare professionals who will be moving with a small bus and, let's say, do some screening of the touristic sites, and this will be very good for the tourists, and it will also be very good for everyone who is working in remote areas, and we're doing it throughout the year. And in the region like mine, it actually works quite well. But then you also can have the market. So you can go and have some treatments, healthcare services in the market after you have bought some vegetables or whatever, to have some advice and so on. But this has to be organized at the regional level. We actually have to really help and support these local health contracts to finance them. Well, I have this example in Narbonne. They have done it with our support, and it works quite well. Well, here I think that we will be really targeting people. I was at another workshop in Ariège, right next to Tarascon, for those who know it. If you don't know it, well, I would like to invite you to go and discover this region, because it's very beautiful in there, and the weather is better than here. But they have created the actions. They have created this journey that is very much adapted for people who are with disabilities or old people. So they have everything adapted because everyone is participating in this process. So I would like to say that thanks to this, we have this prevention that allows us to prevent practically all of the diseases. And that's a determinant point here. So we have to be as close to people as possible so that to really, really work with them and to really target them. I think that this is the right vector because this vector that we have chosen, this direction that we have chosen actually unites absolutely everyone. So we have the medical stuff, we have the social components that are here. We also have, well, whenever you are, for example, creating the fitness fields in or fitness corners in your commune, you will be able to participating in this effort in terms of the improvement of the health. Well, we understand that sanitary democracy is also something important here because we have this Parliament of Health, as I call it, that looks at all the decisions and makes sure that the decisions are being financed. So you see, this is basically a big chain of all the different stakeholders, and in terms of all the decisions, we understand that we have to provide the right answer, the united answer, and the population must be very well served. That's the most important thing about all of this. Well, we have been talking about all the stakeholders in Occitanie, and right now I see that you are a little bit less enthusiastic than all the others. Well, not really less enthusiastic, but we are thinking about prevention and care. And for us right now, this is still the jungle. This is still not really very well determined who will be doing this prevention, who will be doing the screening in terms of the prevention, whether this will be the nurse that will be asking these 45 questions to the patient, and finally this assessment will be done. Okay, so and then what else does it represent? I think that the definition per se of this prevention is not very well created yet. And of course, we have the CPTS, the healthcare facilities, the hospitals, and so on that are participating in there. But I think that the prevention right now is too general as a term. So everyone should be taking care of it, but no one really does do it fully. So you have to be professionals or associations or what. So I think that it's not very well determined yet. And I hope that the members of parliament can hear us as well, because I believe that the prevention is something that must be a little bit better defined and made a little bit more tangible. Well, probably the very last word for everyone, Thierry Godot, you first. We still have 3 minutes left. All right, so in terms of the prevention, I say that I completely agree with what has been said, because it must be coordinated, because today I believe that everyone is doing something on their own, but it has to be coordinated around the goals that will be measurable. And I think that probably in terms of financement, we have to go to something that will have a little bit more ROI. Let's say for diabetes, something that will not create complications, that will be less expensive. So if this is a conclusion, I would like to say that we have to finance also what we can do. Let's say to make less medical acts, to have less pathologies and so on. So we have to finance these efforts. And we also talked about the quality of treatment and relevance, as well as economical efficiency, because it's always the question of who will be treating the patient and at which moment. It has to be the right moment. Now, going back to the prevention in terms of conclusion, the local health contract that allows us to develop this process when we address the right medic, the right doctor. We also have to consider the prevention, so that to look forward into the future, 5 years forward or something like that, because, for example, the cancer can be related to different risk factors, and we have to target all the actions, preventive actions at the national level that will probably address people who have this high risk, so that to give a good example to others as well. Didier, your conclusion? I would like to say that we have to be optimistic, and we have to have this willingness. And we don't have to work for today, but for tomorrow. I don't want to be the person who will be judged in 2040 saying that he did not give a certain agreement and he didn't make the right decisions and so on. I think that for us it's very important to really look into the future, so that for SHAM 2040 we will be able to say, Madam the President, we actually succeeded and it actually worked, and health care is present all over the French French territory. So we are talking about 2040 right now. Emmanuelle Malheureux? Well, my colleague has been talked about this very beautiful story. So hopefully we will be able to create this very beautiful history for healthcare through the young generations as well. And hopefully they will be a little bit more multidisciplinary and working much more in teams. And I would like for us also to highlight the new technologies, because the healthcare facilities have asked for the authorization to have the interns, healthcare interns working there. And I think that this is for the young generation that will be able to change thanks to us. And I hope that this will be also the case for the other healthcare professionals and also part of the training for the students. Well, thank you very much. Right now we see that with the tools that we have in our availability, we have quite a broad range, and it allows us a lot of things. Thank you very much to all of you. We can stay optimistic.